In 2014, West Africa was gripped by fear. A deadly virus known as Ebola was spreading like wildfire through Guinea, Liberia, and Sierra Leone. Hospitals collapsed under pressure, entire communities were devastated, and thousands lost their lives in agony. But amid the panic and despair, one man stood at the front lines, risking everything to save his country and people. Dr. Sheik Umar Khan. A name few remember, but one that deserves to be etched in the history of African heroism. This is the true story of the man who stopped Ebola. Dr. Sheik Umar Khan was born in Sierra Leone in 1975, in the eastern town of Lungi. He grew up during a time of political instability, poverty, and limited access to healthcare in rural Sierra Leone. Despite the odds, young Umar stood out early. Teachers described him as brilliant, focused, and remarkably compassionate. He had an insatiable curiosity for how the human body worked and a dream to help others. He earned a scholarship to study medicine at the University of Sierra Leone, graduating with honors. He specialized in infectious diseases and later completed postgraduate training in virology, earning recognition for his work on Lassa fever, another deadly viral hemorrhagic illness endemic to West Africa. His research helped establish better detection protocols in under-resourced hospitals. As head of the Lassa fever program at the Guinea Government Hospital, Dr. Khan became one of the continent's leading experts on hemorrhagic fevers. He was a meticulous scientist and a caring physician, known for treating each patient with dignity, even when resources were scarce. But nothing in his experience could match the scale of the storm that was coming. In March 2014, a mysterious illness emerged from the dense rainforests of southeastern Guinea. It began quietly, fever, fatigue, vomiting, but quickly escalated into internal bleeding, neurological failure, and death. Patients bled from their eyes, nose, and mouth. The virus was moving faster than anyone could track. Soon it jumped borders. Liberia reported cases, then Sierra Leone. In a country still recovering from a brutal civil war that had decimated its health system, the outbreak was a death sentence for many. Crumbling hospitals, shortages of gloves, masks for fluids, whole families wiped out. Fear spread faster than the virus itself. Guinea, home to Sierra Leone's only Lassa fever research center, became the front line. And Dr. Khan was appointed to lead the charge against Ebola. He accepted without hesitation. He gathered a small team of local doctors and nurses, many of them former students and colleagues. They set up isolation wards, educated communities, and began the painstaking task of identifying and treating cases. The work was dangerous. Every touch could be fatal. And yet, Dr. Khan suited up every day. As the outbreak intensified, so did Dr. Khan's workload. He worked up to 16 hours a day, entering the high-risk zone multiple times in blistering heat. Dressed in layers of protective suits, goggles, and gloves, he could barely breathe, but he pressed on. He personally diagnosed hundreds of patients. He comforted children who had lost parents. He encouraged frightened nurses. He tracked the spread of the virus using field reports and sent daily updates to international teams. He innovated protocols to increase staff safety. He led outreach campaigns in rural villages, battling rumors that doctors were spreading the virus. He worked with traditional chiefs and local radio stations to counter misinformation. Despite the danger, he never backed down. The World Health Organization, WHO, Médecins Sans Frontières, Doctors Without Borders, and other international bodies sent support, but it was never enough. Beds were too few. Supplies were scarce. The virus kept coming. Yet in all this chaos, Dr. Khan remained a symbol of calm, of courage, of hope. He inspired a generation of African medics to believe in their own power. In late July 2014, Sierra Leone was shocked by devastating news. Dr. Khan had tested positive for Ebola. No one knew how he became infected. Perhaps it was a tiny tear in a glove, a momentary lapse in protocol, or sheer bad luck. But the reality was brutal. The country's foremost Ebola fighter was now a patient himself. He was immediately transferred to a treatment center run by Médecins Sans Frontières. International experts offered to fly him to Europe for experimental care. But bureaucratic red tape and logistical challenges delayed the process. Inside the isolation ward, Dr. Khan remained alert. He was hopeful. He asked for updates on his patients. He encouraged his staff to keep working. He refused to let fear consume him. But the virus was relentless. On July 29, 2014, just weeks after he was diagnosed, Dr. Khan succumbed to the disease. He was 39 years old. His death shook the world. Tributes poured in. President Ernest Bai Koroma called him a national hero. The WHO called his contribution immeasurable. For many, the loss felt personal. Sierra Leone had lost its bravest defender. Dr. Khan's sacrifice was not in vain. His tireless work in the early days of the outbreak bought valuable time. His warnings helped raise global awareness. His death spurred a massive outpouring of aid. Within weeks, the US and UK had deployed medical teams. China and Cuba sent doctors. Vaccines and treatments were fast-tracked. By 2016, the outbreak was declared over. More than 28,000 people had been infected. Over 11,000 had died. But countless lives were saved, thanks to early heroes like Dr. Khan. Hospitals were renamed in his honor. The University of Sierra Leone established a scholarship for medical students in his name. His story became a rallying cry for African self-reliance in healthcare. His legacy lives in the young doctors he trained, in the mothers and children he saved, and in the renewed respect for African leadership in global health. Dr. Sheik Umar Khan didn't carry a weapon. He didn't seek headlines. He didn't wear armor. And yet, he stood at the front lines of one of the deadliest outbreaks in modern history, fighting with science, compassion, and unmatched bravery. His story is not just about death, it is about defiance. About standing firm in the face of fear. About the power of one man to change the course of an epidemic. Dr. Khan reminds us that true heroes are often invisible, until the world needs them most.